Kia ora and welcome back to the Out of the Fog podcast. I'm the host, Kristina Grace, and it's great to have you join me. This is part 2 of a 2-part episode, and it's a bit of a special one because I am the only one talking. I'm not interviewing anyone, and if you haven't listened to part 1, I really suggest that you go back and listen to it. It's really where I have begun a story about how I got involved in maternal mental health, why I got involved, and my story around lobbying, the gaps that I saw in maternal mental health, and how I lobbied government and what I did to try and make change happen. And in this episode, I'll be continuing that story and finishing with, what I imagine in an ideal world, what support would look like for young families, how we could prevent depression or anxiety amongst our mothers or our whānau, how we can better support families, how we can better respond to depression or anxiety amongst our mothers or amongst our families. Yeah, so I'll be talking about that, and obviously, as I mention every week, this is leading up to Maternal Mental Health Week, which is the first week of May, and that coincides, of course, with Mother's Day in New Zealand. So it's been a series that we have been continuing, and I guess with my stepping down from my role with Paternal Care Action Group, this is my sharing of this story is really important to me. Some of my production team may be frustrated that I haven't videoed myself doing this, and that is because, and you will have heard this from part 1, I stayed up all night last night, or most of the night, simply because I couldn't sleep. My mind was whirring. Had a little bit of a setback, as it happens with whenever you manage a charity. Had a little bit of a setback and felt super discouraged last night, and just kind of feeling all the feelings and thinking all the thoughts, and eventually starting to think about next steps and solutions and things like that. So all of that just kept me up, kept me awake. So right now, the last thing I want to do is go on video after having a sleepless night. I don't feel like getting out of my leggings, and I don't feel like putting on makeup or even brushing my hair. So that is why I don't have a video of me. But anyway, back to the episode. We'll kick off where we left off last time. So one of the meetings I had eventually was with Julianne Genter. So Julianne Genter was the Associate Minister of Health, and she also was the Minister for Women. So she was pregnant at the time that I went to visit her, and she was really invested in the cause. She listened to what the issues were. She asked me what was needed, and then she spoke to her people and said, "What can we do about this?" And so she really wanted to actually put something into action. And one of the things I said that would really help would be, as the Minister for Women, if she made it mandatory that DHBs, which is now whatu ora, that they would have to include earmarked funding or ring-fenced funding for maternal mental health, so that it wouldn't get swallowed up, by other causes or other needs. Or because the problem with maternal mental health is that it sort of sits under maternity and it sort of sits under mental health, so it can get lost. And so that was something that I felt that she could do. At the end of, and I just said to her, please champion this cause, please champion it. You will see that there is, I wasn't interviewed for this, but on a program called Sunday, Julianne Genter was interviewed at the end of her, I guess, ministerial term, about maternal mental health, and I don't remember specifically what her words were, what the quote was, but she effectively was saying, I really worked hard in this area. I don't know why I couldn't make change happen. I don't know why. And it honestly, I've had so many people say to me, because I have literally talked to all the right people, I've presented all the right information, I've made submission after submission, and people ask me, why do you think it's so neglected? I've been on a documentary about maternal mental health and been asked that question, why is it so neglected? And you can see that documentary on our website, by the way, if you're interested. It's right down the bottom and you can click on it. And our website is mothershelpers.org.nz. Yeah, so on that documentary, I was scratching my head, and the only answer I could come up with was, well, maybe it's because it's a women's issue. And I do really think that we, as a society, we still have this really high expectation of mothers, and we assume that it's a natural role. We assume that people generally do well in that role, and we expect them to do well, and we expect ourselves to do well. And there's a whole bunch of guilt if we are struggling with that role. So I think it is a woman's issue. I really do. I think that's probably at the root of it. But why we couldn't get major change with a female prime minister at the helm with a role for Minister for Women, I don't know. I really don't know why progress is so slow. So you can imagine that all of this work is extremely exhausting. And sometimes I had support with it and lots of people rallying around me, and sometimes it was just me. Over the last few years, I wrote a maternal mental health report every year from the perspective of Maternal Care Action Group, and I included in it survey results of what is happening in this space. And I would regularly survey mothers in New Zealand about their experiences that affected their mental health, whether it was to do with COVID or whether it was specifically their experience of having perinatal depression or anxiety. And I've been taking those surveys since 2015, every few years. And I collated them and I presented them in a report along with a whole heap of other stuff, like kind of the results of all this lobbying plus research, all the stuff. And I sent it to all the politicians that would be relevant to send to, whether they were involved in health, whether they were involved in mental health, if they were involved in maternity or women's health, and not just politicians, but you know, right across the board, right across the board. We had a follow-up event where we planted a tree for every woman that had died due to suicide. Since the recommendations, I think a long time ago, I can't even remember how many years, I think it's like 12, 15 years, something like that. And we planted a tree for every woman that had died. And organisations donated a tree from all various sectors as a way of saying that they cared about this, and they were committed to doing something about it. At the end of the day, has something been done about it? I hear you asking. And the answer is that I finally got a meeting with someone called Ayesha Varel. Now you can imagine, she's a minister. She's in the Labour Party and she's a minister currently in government. And when I got this meeting with her, you can imagine how by this time I am completely cynical that any meeting that I have with any politician is ever going to result in any kind of change. So I'm really sorry to say that was kind of the tired, jaded attitude that I had turning up for this meeting. And I did honestly feel tired by just the hoops and the hoops and the hoops and the hoops, and feeling like it was a brick wall every single time I did anything. And anyway, I had this meeting with her, and the thing with Ayesha Verrell, and I will absolutely give her credit for this, is that finally, now I'm not saying that these gaps have been addressed because they're not, but finally we started to see progress. Finally, we started to see funding going towards the issues that we needed to see. So, for example, recently there was government funding available for someone to train midwives in maternal mental health. And of course, Mothers Helpers applied for that and we weren't successful. And I sincerely, sincerely hope that whoever was successful is genuinely teaching those midwives the issues or the information that their knowledge needs to have in order to create change in this space, in order for them to be screening, in order for them to be identifying and picking up depression or anxiety. So that happened. Another thing that happened is they have funded some pilots, maternal mental health pilots, and that is going on. There's some research going on. So even though it's slow, even though it is like a snail slow, it is still moving. And I have to say that prior to Ayesha Verrell, I haven't seen that. So I have to give her credit for that. And I honestly, sincerely, whenever I send her a maternal mental health report, I acknowledge that she has done some work in that space. And I want to give her credit for that. Do we need much more than that? Yes. Yes, we do. So I want to talk to you a little bit about the other thing that happened. And I hope you're hanging on. I hope there are some people that are actually interested in this story. And it's not just me that gets interested and passionate about this stuff. The other thing that happened was that when the Labour government got in, after the mental health report, they rolled out a mental health plan in response to that. And part of that plan was this program that was pretty much adopted. It was a model that ProCare had been using. And if you don't know ProCare, they are a really big primary health organisation in Auckland. They had been using it, and it's a model that's used in the United States. I hear you asking, is a model from the United States something that we should, in New Zealand, Aotearoa, be replicating? I am just going to leave that there. So we had this model. I guess it was ready to go. It could be rolled out quickly, and it had been researched. So I guess it was just, I don't believe it's the best model. I think a lot of people in not-for-profit sector would agree with that, because the not-for-profit sector were doing amazing, amazing stuff, like Mothers Helpers is doing amazing, amazing stuff. So it's a shame in many respects that we didn't go to our not-for-profit sector and say, hey, let's look at what you're doing and what's going really, really well, and let's fund that. But anyway, so we got this model, and they did do some of that. I'm not going to say that they didn't. There are some very, very big NGOs that got some funding to do more of what they were already doing. But a lot of little not-for-profits like Mothers Helpers that didn't get a look in, even though we're doing really good and effective work. So back to the model. So the model is basically that their per population, and I couldn't quote you on how many, a general practice would get a health improvement practitioner connected to that practice. Now, that health improvement practitioner would be a social worker or a psychologist or someone who had a background in mental health and some training. And they would be trained in something called FACT. And FACT stands for Fast Act Therapy. So if you're familiar with ACT therapy, it's that, but it's fast. So at one stage when Mothers Helpers funding was shaky and I was thinking, might have to find another job, I applied for a hip job, and because I'm a registered social worker and worked in mental health, so I applied. And in one of the interviews, I was told very clearly that one, I would not be able to use any other approach, any other talk therapy approach, even though I was trained in multiple approaches, that I could only use the FACT approach. And secondly, I was told that I would only be seeing a client once or twice. And if I saw them more than that, that would be looked on. That would be really seriously looked at. And it was actually up to the health coaches who were trained, but they didn't have any particular qualification of any kind. They didn't have a certificate in peer support or mental health support. They were just had in-house training. So those health coaches would keep in touch with the person. So that to me was not something I could go with. And so I withdrew my application. But it concerned me because even though so the theory is that, your GP picks up that someone has got a mental health issue, send them through to see their health improvement practitioner. The health improvement practitioner comes up with a plan and the health coach helps them to execute it. That is generally what the idea is. There's a lot of issues with it. Okay, so number one, the health coaches aren't trained in anything other than the training. And I could be wrong about some of this stuff, so I'm really happy to hear back from people who think I'm completely wrong. But I'm just telling you as I understand it. So the health coaches are not trained, don't necessarily have any kind of training. They just get whatever training they have in the job. And they are to be fair, they're overseen by the health improvement practitioner. The other problem with it is that the health improvement practitioner, they cover so many people that often they are covering multiple practices. So they're not necessarily in the GP practice that you attend. They may be connected to that practice, but they may not necessarily be in that practice. The other thing that is a problem is that the health improvement practitioner can refer that person to specialist counselling, but they really can only access about 4 funded sessions. So you'll remember before this mental health rollout that GPs could access 4 funded counselling sessions anyway, some of them 6 funded sessions, and that's still true. So some practices will be able to access 4, some will be able to access 6. So that actually hasn't changed. That's still the same, and they still run out of money for those packages. For instance, we've got a contract with someone, they've only got 48 packages of care per year, so they can only refer 48 people to our service, and once they've run out, they've run out. They can't refer anybody. So it's the same kind of thing as what we had before. So the really only difference with this mental health rollout is that we now have HIPs, which stands for Health Improvement Practitioner connected to GP practices, and we have health coaches connected to GP practices. A reminder that not everyone goes to the GP, not everyone can afford to go to the GP, and not everyone identifies that they have to the GP that they have an issue going on. So it still doesn't address the issue of screening. It still doesn't address the issue of poor education in antenatal classes around depression or anxiety. It still doesn't address the issue of low referrals, and it still doesn't address the issue of insufficient funding for counselling. I've had mixed feedback about health improvement practitioner experiences and health coach experiences. I've had feedback that it's wonderful. I've had feedback that it was terrible. So we will know in the years to come. But it is, in my view, kind of a medical model in the sense that it's connected to the GP practice. Um, and, the idea is that, it sort of harkens back to the olden days where everyone used to have a really good relationship with their priest and their GP, their minister, their local church minister and their GP. But that's not true anymore. A lot of people, especially men, I would say, just do not go to the doctor. So I don't know that it was the best way of doing this. And it's frustrating because it's cost millions and millions of dollars, and it's done now. It's what we have to work with. So what Mothers Helpers has done is that we've gone to primary health organisations and asked to be on one of their contractors as a specialist provider so that they can refer to us for funded counselling. The problem is that the majority have said no. And that is because they feel like they have it covered. They feel like the counsellors that they have already got in place have got maternal mental health covered. And that's because they don't see that maternal mental health is a specialist field. And that's another issue for me. So in my last maternal mental health report, I pointed out some of that stuff and I sent it out. And of course, I'd never get a response from anyone about this stuff, anyone that, could make a difference. So all of this to say that these are the issues that are presented in maternal mental health. Now, last year, when I went overseas, I found myself in Italy speaking to an Italian cardiologist about the symptoms I'd been having about my heart, which had started with skipping a beat when I walked up hills to chest pain when I walked up hills. And he said, I think you've got stenosis in your heart and we need to send you for an angiogram urgently. The day before I was due to go in for an angiogram, I had a heart attack. And I went to the hospital and they sent me home because they didn't recognize that it was a heart attack because I had no ECG changes. I just had high troponin levels in my blood, which is called a non-STEMI heart attack. Fortunately, my cardiologist got on the phone to the hospital and got them to admit me. And consequently, I now have a little piece of Italy in my heart. I have a stent in my heart, and I also had to have a second angioplasty and quite a number of days of really, 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 really horrible hospital food. Apparently, Italian hospitals are infamous for really bad food. And so ever since then, I decided I needed to make some lifestyle changes, and one of those was to reduce stress. And you will hear me in future episodes talk about this experience and how it impacted on my mental health, because it did. And so if you've had any kind of health condition and that's impacted on your mental health, those will be good episodes to listen into because I'll be talking to some experts about that. But, one of the decisions that I made was I needed to step down from my role in Maternal Care Action Group. And my hope, and it's kind of my appeal as I'm sending this episode out there, my hope is that there will be other people who are willing and passionate about this cause and want to champion it and stand in my place to do that. For me, having given so many years to lobbying to try and make change happen, that is something I need to now step away from in order to take care of my health. And so, so I really, really hope that there is a person or a group of people that really, really want to lead that forward, champion that cause, because even though we are seeing slow progress, it needs to be championed. It's a cause that needs to be talked about. And I worry that that neglect of this particular area of mental health or this particular area of maternal health will continue to be neglected, with really awful results, both for mum and child and whānau. This podcast is brought to you by Out of the Fog. At getoutofthefog.org, you can find counselling or counselling supervision with me, Kristina Grace. There's also online training for therapists in the Out of the Fog program. The Out of the Fog program is designed for counsellors and therapists to use in individual or group therapy. It's holistic, uses multiple evidence-based therapies, and it's effective with up to 90% well within 9 weeks and a 48% reduction in depressive symptoms. The website again, getoutofthefog.org. So I want to tell you a little story. Whether I was running group therapy programs or seeing clients for individual therapy, time and time again I'd meet people that could not or did not want to take prescription medication, or I'd find people that were on prescription medication but needed more support. Now, as a former registered nurse, I'm a believer in prescription medication for moderate or severe mental illness. I support and often refer people to doctors, crisis and mental health teams to be assessed for prescription medication. But I could see there was a huge interest in natural medicine in my own practice, and so I went to herbalist Jeremy Patterson, who was qualified in naturopathy, and begged him to write a book on supplements scientifically proven to support mental health. I am so pleased to announce that it is now available as an ebook that you can purchase through our website for as little as $5 New Zealand dollars. Not only that, but we have a full range of our very own mental health supplements called scientific supplements. I would not recommend to you anything I wouldn't take myself, and I do use some of these supplements. Go to getoutofthefog.org and take a look. This is a really long episode, and I really, really want to thank you for hanging in there and listening. But before I go, I want to talk to you about what I see that would be a really, really good maternal mental health or maternal health support that would be kind of my dream, I guess. If I was in an ideal scenario, what would it look like for me? Having worked in this field, having experienced what I've experienced, having spoken to so many mothers, and so many professionals and clinicians in this field, what would it look like to me? So I just want to finish with describing that. So this is my ideal scenario, that all mothers during pregnancy and postnatally are screened by midwives. But they're also screened by practice nurses. And this is something I've suggested before because I've been a practice nurse before. And they have recalls. They have a recall system where they could pop in a screening tool, which, by the way, takes 2 minutes. The patient fills it out. On Mother's Helpers, we've got it's called an Edinburgh scale, and it actually scores it for you and tells you the results. So you don't even really need to be trained in it. You just need to use that tool on our website, and it will self-score and tell you the result. And it even gives you recommendations about what to do. So it's super simple. So there's no real reason not to do it. But anyway, I would love to see both midwives and practice nurses all screening, and several times during pregnancy, and at least once in that first 6 weeks postnatally. Maybe more if they have more risk factors. I would love to see HIPs doing that, health improvement practitioners. We have this model now. So if they are not neglecting maternal mental health and they are actually going to be covering maternal mental health well, HIPs should be screening. So antenatal education, I really strongly feel that needs to be massively looked at. We need to incorporate the psychological changes and transition that parents go through when they have a baby. We need to be educating on the signs of depression or anxiety and what to do if they find that they have it. Even to be giving them a screening tool, such as the link on our website where they can self-screen. The next thing that in an ideal world would be a clear pathway. I really feel like the whole HIPS model is almost like a best kept secret. And I think it's honestly because it's this is my cynicism coming out. But I sort of think that if they advertise it too much, then it will be used too much and they will get overloaded and they won't be able to deal with it. The problem with that is that if demand doesn't overwhelm the system, then we never know what the demand is. Does that make sense? So in other words, we can never say what we've got is insufficient because the demand has matched the availability. The problem is that most people I know, and there are, don't get me wrong, there are people that know about HIPS, have heard about HIPS, know that they can go to their GP and access some mental health support, but there probably are more people that don't know about it. And I certainly don't feel it's been advertised. I don't feel like it's common knowledge. I'm not seeing any advertising anywhere. And I honestly wonder about what would the demand be like if it was. And my hunch is that it would overwhelm the system and the system would fail. And I think that's probably why it's not being advertised. So that is, to me, is not a clear pathway. And it comes back to some clinicians will know about it, some clinicians won't. And that's never been a good pathway. And we've always had that problem where it's not common knowledge that this is the pathway that you go down. I think there's not an understanding amongst, and I hope that this could be taught or education for GPs, HIPs and midwives, that understanding what the risk factors are for mothers with perinatal depression and anxiety, that they would therefore keep a closer eye on those mothers, but they need to first be educated on what those risk factors are. And the other thing, I guess, is also looking at services that are funded services. So for me, I feel, and I'm really open to hearing a different point of view, but I feel that mental health for mothers is very specific, and not all counsellors will necessarily know the specific issues that mothers are facing and need to address. And I feel that, one or two sessions with a HIP, now I'm bearing in mind that I'm aware that some get to see their health improvement practitioner far more than 2 times. I'm just saying that was the model that was told to me. And so it probably there are many regions where they get to see their health improvement practitioner a lot more than that. And I would imagine that works much, much better. But for those that are seeing them once or twice, and then they just have to make lifestyle changes with a health coach, I really doubt that that's going to be addressing mild to moderate depression or anxiety. I really do. I'd like to be proved wrong, but I really have my doubts about that. I also don't really feel that 4 counselling sessions is enough. In our case, we've managed, in our package of care with one of the PHOs that we've got a contract with, we've managed to get our group therapy fully funded. And so they have access to 9 group therapy sessions plus an assessment free of charge, fully funded. That, to me, is, and we have the statistics to show, 90% are well by the end of the course, 52% reduction in Edinburgh scores, which are depression scores, and to be honest, that group therapy It costs about 1 to 2 counselling sessions. It's the equivalent of the cost of 1 to 2 counselling sessions. So it's super, super affordable. And no matter how much I have presented this affordable, effective program, no matter how much I have presented that, we have not got government funding for it. And it is totally up to the discretion of the primary health organisation whether they fund that. Some are completely bound and they're not allowed to fund group therapy. They can only fund individual therapy. It's frustrating, I can tell you. So anyway, back to my dream scenario. The things that I'd like to see funded, where there is a robust assessment, where there are referrals being made for wraparound support for families, where there is funded group and individual therapy as needed, and that this service is measured for improvement. Mothers Helpers does all of those things, but I'm so passionate about this cause that and I've always pushed, it doesn't matter whether it's Mothers Helpers, if anyone does this, whether they're doing robust assessments, whether they're doing really good referrals that provide community support to this family, where they have funded group or individual therapy available to them, where they are measuring improvement and can say what we're doing is effective. We are getting a reduction in depression and anxiety symptoms. We are getting an increase in well-being. Then I think that should be funded. But I do feel like it should be specific to people who have and are trained in maternal mental health with the specific needs that mothers and families with young children have. This would absolutely reduce the load on secondary and tertiary services so that they can take the women that really, really need that level of help and really, really need respite. In an ideal world, I would love to see, and it is my dream, that we have things available like Parent Aid, which you can find in Auckland, who provide temporary but free childcare and housework. Because there are so many families that just do not get a break for so many reasons, whether it's they just don't have the family support there, they're estranged from their family, they're a sole parent, they've got depression, or they've got anxiety and they're not sleeping, they've got a colicky baby, all sorts of different reasons where they are really, really struggling. And that practical support is massive. And every time I've ever done a survey, that is the thing that mothers participating in the survey has identified as being the most important thing that would make a huge difference in their lives. The other thing would be, in my ideal world, is somewhere, a place of respite before it gets bad. So not just when mental health is so utterly bad that we're staying in hospital with moderate to severe, if not severe, depression or anxiety, but actually respite where there is this wraparound support for mum before it gets that bad. That they can actually, and even more preventative than that they can go to as a preventative measure, that they're just like, what, I really need a break. I really dream of things like family hubs, that, because, actually being a parent is super isolating, and it's such a huge issue when you are a new parent, is that you feel isolated, you feel disconnected, you feel a loss of the communities that you were perhaps part of before. There's a lot of times mums or parents, I'm going to say parents, just don't connect to the groups that are out there because they are baby focused, they are child focused, they are not parent focused, mum focused. They're not focused on necessarily socializing with each other or supporting one another's well-being. It's more a focus on, let's have our children play together. Let's encourage education through play with our kids. So it's the focus is constantly on baby. And I remember that. I remember going to those playgroups, and I remember going to those kinds of places and just feeling really lonely, and it just was great for my child, but it wasn't great for me. And so I dream of, these community spaces where we've got these community halls that are just sitting empty everywhere. And I wish that they were turned into family hubs. I really do. And that we had the ability to really wrap around and support families, where they could go to these hubs, these community spaces, and find friendship, get a break from childcare, have a cup of tea, attend classes, get some education, see their midwife, see a lactation consultant, connect in with someone like Mothers Helpers or a counsellor or whatever, Plunket, whatever the thing is. I just wish that there was a hub where there's a hive of community, a sense of community that was fostered there. And I look at those at our community centres, and some would argue, oh, it's great, because the karate group hires it, and then the age concern hires it, and then I don't know, some dance class hires it, and so it's great, but I just feel like there are a lot of empty community centres that are empty for hours and hours and hours at a time. And I just really feel that what a waste of space, what a waste of resource. And what could we do where we could kind of connect all of these supports that are available, that exist in the community, and wrap them around a family centre for free. It's not something they have to pay for, but was funded. Don't have to hire the hall, but it was really, really resourced and funded. And I just really feel like what a gift to the community that would be. How much more support families would have. There's an amazing group called, I think it's Grandparents. No, I've forgotten what it's called. But basically what the organisation does is that it has grandparents that volunteer to kind of adopt, I suppose, a young family. And so it's awesome for both parties, because the grandparent, so to speak, is giving back and is not isolated and lonely, but part of a family's life. And the family, who may be estranged or separated or something from their own family, can experience support. Stuff like that is amazing. But a lot of the time, people don't even know that those services exist. And so this is what I mean about this idea of the family hub. And I haven't just come up with it by myself. This is something that people who've been working in this space for a long time, we talk about this stuff. And I would love to see that happen. So I'm just going to finish it there, because it's been a super long episode. I wanted to share my story of the work that I've done in this space. I wanted to acknowledge, and there are so many people, like I'm thinking about them right now, and how many hours, how much time they invested in supporting the work of either Maternal Care Action Group or Mothers Helpers. Voluntary time, donations that we've received and still receive. I just really want to acknowledge those people and thank you for your support. And I want to really encourage you that if this is an area that you're passionate about, please reach out to me, because I am looking to hand the baton over to, I hope, multiple people who will pick it up and continue this cause. It is time for me to hand that baton over, and I hope that there is someone who will pick it up. I will continue the work of Mothers Helpers along with my team. And I really, really hope that anyone that's kind of listening to any of this stuff, if you are a change maker, if you're in a position of influence and you can do something to address these gaps in maternal mental health, I'm willing to talk to you, but I want it to be a fruitful conversation. I want it to result in action. I want it to result in actual change. And if you're someone who has heard some of these ideas around what is possible, what we could do, what maternal mental health could be like, and you feel like you have the ability to contribute to that, whether you're a primary health organisation that could give a contract to someone who is delivering an effective service in maternal mental health, whether you are a midwife that could be screening, a practice nurse who could start recalls that screened mothers. If you're a health improvement practitioner that wants to do more training on maternal mental health, if you just care about this stuff and want to get together with other people and create a family hub in your local community centre, whatever it is that has inspired you, wherever you are, whatever you're doing, if you want to be involved with that and you want to reach out to me to ask me any question about that, just get in touch. The best way of getting in touch with me is through my Mothers Helpers email address, or actually through the main email address for Mothers Helpers, which is info@mothershelpers.co.nz. I can't respond to every inquiry. So if you can give some details in your email, I will try. If it's just kind of like a please call me, I probably won't, because we are just so overwhelmed with work. But if I know more about your situation and what you're wanting to do, I will do my best to reply. Thank you so much for listening in, and we will be continuing this conversation with Kate Hicks from Birth Trauma Aotearoa. I would really love to hear what she thinks about some of the things that I've talked about today, but also about birth trauma, because I think that is an important part of maternal mental health. I'd love to hear some feedback from you. If you have experienced a really, really great service as a result of being in touch with the health improvement practitioner or health coaches, I'd love to hear that. If you've had a really bad experience of it, I'd love to hear that too. I'd really just like to know how our current but very new mental health system is working or not working. And so, this podcast, there is room to give feedback on Spotify. There's room to give feedback when we post it up on our Facebook. There's room to give feedback or comment when we post it up on Instagram. So whatever feedback you have, if I get enough feedback, I will, I'll read it out next time we have an episode. But I would love to hear from you, because I'm just talking about my experiences to date. And a lot of this mental health rollout is relatively new, and I don't know what people's real experiences are of it. So I'm really curious and interested to find out. Again, if you have anything that you want to say and you don't want to comment on our platforms, whether Spotify, TikTok, Facebook, Instagram, you're welcome to drop me a line to my email. I've got two emails. One is through Mothers Helpers, which is info@mothershelpers.co.nz. And the other email address I have is getoutofthefog.org@gmail.com. That's getoutofthefog.org@gmail.com. Thanks for listening.